So I've included all that now in this paper. A World Health Organization report that's published on October 3rd, 2002 is the first to address violence against the elderly as domestic violence and as a global public health problem. It kills more than 1.6 million people every year, and a large number of them are elderly. These are some of the facts about the elderly in India. HelpAge India is an NGO established in 1978 for the research, advocacy, and running of old age homes. Says on the basis of regular surveys that by 2011 there will be about 90 million grey population in India. Delhi alone is home to nearly 1 million senior citizens, and crime against elderly is 4 times higher in Delhi than in Mumbai, or double than that in Bangalore. This is a data which has been quoted from the police headquarters from the 3 cities. 52% of cases of violence is sourced from their own children and relatives, and rest of them are from strangers and criminal elements. Again, I'm quoting the report, which is from the Bureau of Police Research and Development, Ministry of Home Affairs, Government of India, September 2009. Now, going back to my original practice and my epistemological concerns, anthropology and the elderly. Given anthropology's historically great interest in kinship, it should not be surprising that family role and dynamics, quite apart from the issue of caregiving to the elderly, have been a major research focus. During the 1980s, Potash, an anthropologist, eschewing the traditional structural functional mode of analysis, organized a set of papers that took the perspectives of widows, widowers, and the elderly themselves, demonstrating the options and the constraints that shape the possibilities open to them. Anthropologists have earlier too paid special attention to the needs of immigrant and refugee elderly. Ingalls has considered their special health needs, but in addition to physical problems, elders may also experience severe disruption in family roles and other aspects of their lives, with profound implications for their mental health. Beyond the family, anthropologists have investigated other categories of social networks too. In the Indian context, the rapid urbanization and breakup of the traditional joint family system has affected the process of social aging and care for the elderly in a significant way. The violence experienced by the elderly is a resultant effect of breakup of traditional security networks in the face of modernity and rapid urbanization. In his seminal work, Risk Society Towards a New Modernity, the German sociologist Ulrich Beck presents, as the title suggests, 2 interrelated arguments regarding modern society. The first thesis concerns the emergence of what Beck terms the risk society. He proposes that we are moving towards a risk society, and he argues that we are eyewitness of a break within the modernity, which is freeing itself from the contours of classical industrial society and forging a new form, the industrial risk society. Within this new social formation, Beck argues the consequences of classical modernization, in particular scientific and industrial development, has produced a set of social, political, environmental, and personal risks qualitatively different from those produced in the past. In this context, I would like to go back to the data on violence, which I've quoted just right away. These are the risks we are faced, and we have to look for possible solutions or possible models. These manufactured uncertainties, as Beck terms them, differ from the risks encountered in the past in several ways. Beck argues that where industrial society was based on the distribution of products or goods, its successor, while continuing this production, is concerned primarily with the distribution, prevention, minimization, channeling of these elements modernity has to become truly flexible in order to counter these challenges. Following this line of argument, one can also begin to understand the role of alternatives to homes, alternatives to traditional family networks, traditional social security, and then aging in an ashram in this context of modernity and uncertainties. That's what I'm going to argue now. The central issues addressed in this discourse are how do the traditional cognitive and symbolic categories respond to aging, decline, and death. The reasons have been quoted as a sense of dignified aging which grows in a community living in an ashram. This state of being has been acknowledged by several respondents in the ashram as an essential element for psychological well-being. I would also like to discuss the political economy of social aging in India